So, hello guys, welcome back to my YouTube channel. I am Divya, CPC certified medical coder. So, today we'll continue the musculoskeletal system topic, that is TOPAZ and the TENEX procedure. So, let's begin. So, let's understand why these procedures are performed. So, these two terms, that is TOPAZ and TENEX, they were the minimally invasive procedures, or we can say that technique, which is used to treat the chronic tendon pain or chronic condition pains or damaged soft tissue. Okay, especially uh, when the conservative treatment fails, like the medication, physiotherapy, or injection fails, then these procedures were done by the physician. Some common condition you can see that here, that is plantar fasciitis, Achilles tendinitis, tennis elbow, patellar tendinitis, etc. And these were the although both the treated damaged tendon tissue, and the technology and the physician works different. So basically, we can say that what Topaz and Tinex, these were basically a technique. Okay, these were some special medical device. You can see here in the pic that this is an Tinex ultrasound device. Okay, this is an coablation Topaz. So these were the specialized medical device which is used during the treatment. Okay, so let understand one by one what these Topaz procedure and what these Tinex procedures are. Okay, so here, so the Topaz procedure uses a radio frequency energy to stimulate the healing in the damaged tendon or the fascia tissue. So what will and it is done for the these conditions we already discussed, that plantar fasciitis, chronic tendinopathy, or etc. So the medical necessity will be same, but the technique were the different. Okay, like the sometime topaz for the sometimes the for the plantar fasciitis condition, physician will perform topaz procedure. For same condition, he will also perform Tinex procedure based on the condition, and based on the what severity or all things, what the physician perform, we'll see the details. So what will physician basically do when the conservative treatment fails? The physician makes an multiple small puncture holes in the affected area. Okay, and topaz vents or topaz is a probe which is inserted into through the small holes, and the radio frequency energy is applied to the diseased tissue, and this create an micro channels in the tissue which increases the blood flow and promotes the healing. So by doing this, it will reduce the chronic pain or they stimulate the tissue repair. So basically, topaz, we can say that it is an minimally invasive procedure because only small puncture opening are made instead of the large incision. Okay, so it is an radio frequency procedure. Okay, radio frequency microdebridement, and there will be no large incision will be there. Okay, so small puncture will be there. Okay, so topaz is an radio frequency. The difference is topaz is an radio frequency, and there will be no large incision. There will be a small puncture will be there in the affected area or skin. Now, coming to the TNEX procedure. So, what the TNEX procedure is? So, TNEX is an percutaneous ultrasonic tenotomy procedure. Okay, and it uses an ultrasound energy to remove the damaged tendon tissue or the fascia tissue. Mainly done for the condition we have discussed, that the medical necessity will be same, the condition will be same, but the procedure or technique will be different. Okay, so when the conservative treatment fails, the physician will perform the TNEX procedure where he will make an small incision or puncture, and he will uses a ultrasound probe and inserted into the diseased tissue and get aspirated and small bandage has been applied. Okay, so coming to next, that is ICD. So what were the ICD? ICD, that is a diagnosis. That depends upon the condition what has been treated. And diagnosis must support the medical necessity also. Examples, M72 series will be the ICD, M7660. We'll see in the these ICDs navigation in the operative remote navigation. Okay. So CPT. Coming to CPT, there will be a no specific CPT code for the TOPAZ procedure. So TOPAZ is in radiofrequency uses, minimally invasive radiofrequency procedure, and this there is no specific CPT for this TOPAZ procedure. So how we code? So the coding depends on the open versus percutaneous approach, fascia versus tendon, anatomical site, or based on the documentation. Let's say understand. So if a topaz performed through a open approach, then there will be a standard codes. What standard codes means? The code having some meaning. For example, 28060, that is fasciotomy. Okay. And 28250 division of plantar fascia, 27680 tenolysis, tenotomy. So these were used for it open for the open when the topaz performed through the open approach, then there will be a standard code. But if the topaz performed through percutaneous, then there will be a default unlisted code because it's a radio frequency heat uses waves instead of cutting. There will be a no cutting. Okay. It uses an heat waves radio frequency. So there will be a no CPT code present. So we'll give the unlisted default code, that is 288992499 based on the anatomical location. For next one, if the topaz treated on the fascia or the tendon, then we have to check first whether the incision, minimal incision or the percutaneous has been done. For the in minimal incision or direct visualization, that is, we can say that open approach, will give the standard CPT code, and for the like 28008, and will give the unlisted CPT code for the percutaneous. Similarly for the tendon also. So it's easy. We'll see the approaches first, whether it is open approach or percutaneous. Then we'll see the anatomical location also, and whether it is performed on where, whether it is performed on fascia, tendon, or based on the documentation, whatever the given, we have to code that. Coming to next. Now for the TENEX. So for the TENEX, that is an ultrasound cutting, there is usually a standard percutaneous CPT code for the TENEX procedure because there will be a physically cut. So the codes like 24357, 28008. So there will be a standard codes. Okay, that means something. And now, when the TENEX procedure is performed on the rare anatomical site, like which completely lacks the percutaneous, for example, gluteus medius tendon, hip tendons, these were there will be a no CPT code present. So we'll give the unlisted for the TENEX procedure. Okay, or sometimes if the insurance is strictly written or pair, that they will not accept the percutaneous code for the ultrasound ablation device TENEX. If present in the CPT book also, when insurance strictly that avoid that, he is not accepting the percutaneous code for the TENEX procedure or the ultrasound cutting, then then at that time we have to give the unlisted CPT code. Okay, coming to next. So we'll see the example of the OP reports. We'll see the navigation. So here's an preoperative diagnosis, that is chronic plantar fasciitis, right foot. Post-operative diagnosis, same. Procedure, topaz, radiofrequency, microdebridement, right plantar fascia. Anesthesia is local anesthesia. Operative report. So the patient was placed in supine position. The right foot was prepped and wrapped in sterile fashion, and the attention was directed to the plantar medial heel at the site of the maximal tenderness, and the multiple small punctures hole were made over the plantar fascia, and the topaz radiofrequency probe was inserted through the puncture site, and the micro debridement of the plantar fascia was performed in the grid-like pattern, and the area was irrigated and the sterile dressing applied, and the patient tolerated the procedure well without complication. So here, what were the key points? First of all, the location is what? Location is plantar fascia, right side of the foot. Okay. And the second one, there is a small puncture, multiple small puncture. It means that it is an percutaneous approach. Okay. There is no incision. So it is an percutaneous, and there is an topaz radiofrequency probe inserted. Okay. So if the topaz radiofrequency uses a percutaneous approach, then we have to give default unlisted CPT code based on the site. So we'll see the navigation of this uh, procedure. Okay. Plantar fasciitis, it's an plantar fasciitis. So fasciitis will navigate fasciitis, plantar, not wish to code more. Okay. But here given it is radio frequency, and there is an plantar fascia. And what if there will be open? Let's take an example. Sorry guys, fasciotomy. And this is in standard codes of the foot and toe. Okay, but we have to give the unlisted CPT code. So this one is an unlisted CPT 28899. That is an unlisted procedure for the foot and toe. So 28899, 28899. Okay, and we have to give the modifier based on the location. If it is right side, right side. If it is left side, left side, or toe modifier based on insurance and all. Now coming to next OP report. Same, that is chronic plantar fasciitis left foot. Post-operative same procedure where the percutaneous ultrasound fasciotomy debridement TENEX procedure, and the left plantar fascia under the ultrasound guidance anesthesia, local anesthesia. Operative report and description, that is, and the patient was placed in the supine position. The left heel was prepped and wrapped in sterile fashion, and the ultrasound was used to identify the diseased portion of the plantar fascia, and the local anesthesia was injected, and the small stab incision was made, and the TNEX ultrasound probe was inserted under the ultrasound guidance, and the diseased plantar fascia tissue was debrided and aspirated using the ultrasonic energy, and the area was irrigated and sterile dressing applied. The patient tolerated the procedure well without complication. So same ICD will be there, M72, but we have to give what is the key point here. First of all, here is an TNEX procedure. The second one, that is an location, that is an plantar fascia left foot. The third one, that is an ultrasound TNEX is used. Already we discussed. And the fourth one, that is a small stab incision made. It means open approach will be there. So for the TNEX procedure open approach, we have to give the standard CPT code. Okay. So for the standard CPT code, we have to give the code. So it's an fasciotomy, plantar. So this one. So this one is the left side. This one is in standard CPT code for the TNEX procedure. Okay. So that's it guys for the today. In the next, we'll see the arthroplasty, arthrodesis, and rest remain topics. 5 to 6 topic remain only in the musculoskeleton. So we'll see the next topic in the next week. Okay, so that's it guys for the today. Thank you very much, and please like and subscribe my channel. Thank you.